Hi everyone, my name's Jackie from Kangan Institute and welcome to our virtual open day. Today the webinar we're looking at will be what a career in nursing is really like, a candid chat with a nurse. I'm the industry placement coordinator for our nursing and health courses. So my job is to locate course placements and allocate students to placements accordingly. And joining me today, we'll have Lily Sanzar.
Hi, I hope you're well. My name's Lily and I'm the nursing coordinator at Kangan, and that's at the Moonee Ponds campus.
Thanks, Lily. So before we get started, I did just want to go through some housekeeping rules. You'll have an opportunity to ask questions throughout the presentation. Some of those questions will be answered throughout the presentation and some of those will be answered at the end and some after. Just some general netiquette. Please make sure you're respectful, using respectful behaviour. We won't be using the raise hand function for the questions either. Please also consider people's privacy, safety, opinions and the beliefs of others, and make sure you demonstrate nice language, to put it bluntly. All right, let's get started. So Lily, can you tell me, how did you get started in your career in nursing?
Look, with my career in nursing, I didn't start straight away once I finished year 12. It was always there, but I followed a path of wanting to become a dental nurse, and I did. Didn't like it, and then I did other things, worked in the family business, and thought to myself, you know what, I'm going to follow this dream. So I applied to go to university. I left the family business and I ended up getting qualified initially as an enrolled nurse, and then went on to do my Bachelor of Nursing again back at university. So from there, it's just been an ongoing journey, which has been full of surprises, very fulfilling as well.
Thanks for that. And Lily, what would you say are the benefits of becoming a nurse?
There's plenty of benefits. You're actually making a difference. In the current climate, you can see that us frontliners are making a huge difference to what's going on in regards to the pandemic. It's very rewarding, it's challenging in that you don't know what's going to happen from one day to the next, and it's all about caring and helping others.
Absolutely. Sounds like there's lots of benefits to becoming a nurse.
Definitely.
What would you say, Lily, are some of the things that they don't tell you before you become a nurse?
First things I would say is the shift work. And shift work can be 8-hour shifts, 10-hour shifts, 12-hour shifts. It's mentally and physically challenging as well. And also, you know, you do lose patience. There is a death and dying component, but it is very rewarding.
Yeah, it sounds like it, Lily. I guess that's some of the toughest stuff that they don't tell you in the beginning. Lily, can you share with us a memorable experience that you've had whilst being a nurse?
Amongst there being so many, there's one that really has stuck with me throughout my 20 plus years of nursing. And that was whilst I was working at a major hospital, quite a large hospital in Melbourne. I was allocated a lovely elderly woman who I ended up looking after for quite a while. And her son would often visit, and he would say to me, has mum had a shower yet? Has mum had a shower yet? And I said, no, she flatly refuses. And he kept on insisting, and I couldn't figure out why. And so one day I sat down next to her and I asked her, would you like to have a shower? And as she moved slightly, I noticed that she had some numbers tattooed on her wrist, and she caught on that I had seen them. And I said to her, "Can you tell me about it?" And she said, "Oh, I'm a Holocaust survivor." And so she explained to tell me that her family was lost during that period of time in the concentration camps, and that they were all sent to the gas chambers. And she was one of the lucky ones that didn't go. Um, and so that's where her fear of going into the shower stemmed from. So from that, as a nurse, you know, it's not just about giving medications and injections and taking vital signs. It's all about building a rapport with your patient. And so I sat down with her and, you know, showed her some compassion and spoke. We talked about things for quite a while. And finally, she agreed to have a shower, and on the proviso that we kept the door open, slightly ajar. And her son came in, and once he found out, he was so thrilled. So that's something that's really stuck with me, because as a nurse, you can really make a difference.
That's an incredible story, Lily. That's
Yeah,
gave
it
me a bit of
is.
chills there. My goodness. God,
Mm.
and it sounds like you have to be such a, you know, caring patient. I guess that leads us into, what would you say would be the personal attributes and traits that you'd need to do
Um,
to work in nursing?
You have to show empathy. That's a given, and very compassionate. You're going to meet people from all walks of life, from the homeless to the wealthy and the in between. And they've all got a story to tell. You know, you can't allow any prejudice to come into play or any discrimination. You have to be a great communicator as well. I think that's crucial to being a nurse. And just having that patience, you know, to take the time out and just listen, observe, and assess your patients and really see what their needs are.
Yeah, it sounds like a lot of those sort of qualities are
Mm.
a lot of the nursing students that we have at the moment, and a lot of the nurses, if you know, if any of you have been admitted to hospital and things like that, they're the qualities that that you generally can come to expect when you're being looked after by a nurse. What would you say, Lily, to the group as our final question would be the best part about being a nurse?
A tough one. There's so many things to choose from. Look, I think as a nurse, I've met so many people from diverse backgrounds and cultures, and it's just fascinating to learn about them as well. In this profession, I always find that people are very trusting and respectful of nurses. Um, you know, with nursing, it can take you anywhere. You can take many pathways. You can specialize in in different areas. Um, Job security. You can work all around the world. You can go to any state in Australia and you can find work in the outback, rural, metro. It's just endless. You can work in the community. You can work in a hospital environment, in aged care. It's just a lifelong career. And it's honestly, it's what you make of it. And you can make so many things. You can be a fabulous nurse, and you can just absolutely grasp so much knowledge from whichever pathway you take. And you're
Sounds
forever
like
learning.
opportunities. Yep. Yep. No, that's fantastic. Well, that would then bring us on to a little bit about the Diploma of Nursing that we offer at Kangan Institute. So our course at Kangan Institute is 24 months full time. We say 24 months as opposed to 2 years, just because it depends on the practical placement component, particularly with the COVID. At the moment, if you're, you know, wanting to spread out your placement a little bit, you have any concerns, we're certainly accommodating as we can be with that at the moment. The course is online. It's 3 days per week. Currently it's online due to COVID. Potentially in the future, there's a chance that it may go back to face-to-face classes. We have on-campus practical assessments. So we have some really great labs at our Moonee Ponds campus that students are able to use for their practical components. Placement is also over 440 hours. That sounds like a long time, but when you break it up over 5 placements, it's actually not a great deal of time at all. And that's something that I would come into play, sourcing those placements for you. Our next intake for this course will be in October 2020. We would also expect to have another intake after that in February. Once you've completed the course, you can work as an enrolled nurse. Alternatively, if you would like to continue on from your study to go on to study the Bachelor of Nursing, you would then come out as a registered nurse. So that's just a little bit about the course. We will go through questions in a moment, but I do encourage you that if you are considering applying and you'd like to find out more information, do apply directly through our virtual open day in the health and nursing course page. Now I'll open the floor to questions.
Wonderful, thank you both. That was a fantastic webinar.
Thank you.
So we have a couple of questions here, so I'm hoping you can help. The first one that we have is, someone has asked how heavy on the scale of 1 to 10 was the weight of the course load? Now, I assume that they're talking about perhaps working full time at the same time or trying to balance that with other priorities.
I can answer that.
Wonderful.
So I'm teaching as well, and my students, some are working part-time, some are casual, some are full-time, some have children, etc. It's all about balance at the end of the day. 3 days, you need to obviously liaise with your employer, and it's all got to do with what working hours you do. However, where there's a will, there's a way, and a huge majority of our students do have jobs and they continue to work throughout their diploma. So it is possible.
Wonderful. Thank you very much for that, Lily. Moving on to the second question we have, is it easy to find a job in a hospital straight after completing the course?
I can answer that. Look, I would say definitely yes. There's such a big calling for enrolled nurses now, rather than when I started all those years ago, because their scope of practice has just widened so much. We've introduced the medications module now, so, it's not as restricted. You administer medications, and just having that extra component has just opened up so many doorways. There are multiple jobs out there within major hospitals, both public, private as well. There's a huge calling. There would be no issue there.
Wonderful. Thank you again, Lily. And I have a feeling this one's also coming back to you. And
Okay.
This one is, if they did the 24-month enrolled course, how long would they have to study to become a registered nurse?
Okay, so that's what I did. Okay, so my journey involved becoming an enrolled nurse, okay, which is all those years ago was a certificate 4. Things have come a long way. And then I took a year off to work, and then I applied to go to university. However, a lot of our students, they enroll into university as soon as they know that they've finished their diploma, they've got their registration through APRA, and they've got that piece of paper in their hand, okay, with all their completed competencies. So there would be no issue there. You can take a break, and then what I suggested today, funnily enough, whilst I was teaching, Jackie had emailed me a position for a graduate enrolled nurse to do a graduate year with a major hospital. So what that involves is you actually are employed by that organisation. The difference is you will work as an enrolled nurse within the hospital, but you have a mentor, they educate you further, you have other support systems in place. You go and work on the ward. Initially, it's supernumerary, so you have a buddy nurse with you. So it's not as daunting as, you know, graduating with your diploma, then stepping into your role and maybe having that little bit of anxiety with going, oh, am I going to do the right thing? Of course you are. But this just gives you 12 months of solid mentoring, and in your position as an enrolled nurse, of actually finding your feet down to working out time management strategies, which is really important.
Fantastic. Now we have 2 more questions that have come through. We've probably got time for both of them, but we're probably going to have to call it quits after that. The first question is it hard to find nursing jobs in other states when completing study in Victoria? Definitely not.
Definitely not. This profession is universal. I can go to England and work as a nurse. I can go to different parts of Europe and work as a nurse. As far as any other state, honestly, the foundation is the same. And of course, depending on where you land a job, you always work according to their policy and procedures that they have in place. And I can tell you now that it's usually very much the same. So the opportunities are endless once again. Yes, you can work anywhere.
Wonderful. How exciting. That's so exciting. Jackie, one for you finally. Hooray. This student would like to know whether or not they get directly employed with the hospital that they complete their placement with.
Sure, that's a really great question. So the short answer to that would be no. However, the great thing about placement is that it actually showcases your ability, your skills. It allows you to build rapport with the hospitals. So whilst there'll always be an application process when the hospital is looking to recruit new staff, if you've shone your star, and they've really taken notice of you, then of course you're going to be, you know, very highly considered, as opposed to someone who has not done that before, or who has not had that experience before. So generally speaking, it depends on the facility. It depends if they're hiring at that time. There's a few things that come into account, but it wouldn't be as simple as just doing placement and then getting a job, a little bit like a traineeship. It sort of wouldn't work like that, but still a fantastic opportunity for you to showcase your skills to the people it counts to.
Can I just say with that too, we've had, well, I know students that have actually, you know, stood out on placement, and the hosts that have had them there on placement have actually approached them and said, you know what, when you become qualified, make sure you come back and apply for a job. So that's just letting you know that it can happen.
It definitely seems possible. Well, that's all that we have time for today in terms of questions. So I thank you all for your questions. If anyone has anything further that they would like to ask us, feel free to jump back onto our virtual open day and live chat with us. We are here until 8 p.m. tonight, so we can answer any questions that you have, whether it be about nursing, whether it be about any of our other courses or even our facilities. So feel free to jump back on and ask any questions. With that in mind, I'd like to thank both Jackie and Lily for a fantastic webinar. You've both done a fantastic job. And I wish that you all of our attendees enjoy the rest of our virtual open day. Take everything that you can, have a look at everything that you can. And like we said, we're online until 8 p.m. tonight. So jump on, ask us any questions, and make sure that you get the most out of tonight.
Thank you.
Thanks for
Wonderful. Thank you.
Hope to see you all soon.
Yes, we hope to see you all on campus shortly. So thank you all and have a wonderful night.
Thank you. Bye-bye.
Bye.